Did you know that every 3 seconds, someone in the world is diagnosed with dementia? With 55 million people currently affected, it's become the 7th leading cause of death globally. Meet Dr. Margaret Wilson, a geriatric pharmacist with over 30 years of experience, who's about to share something about memory loss that most doctors aren't discussing with their patients. What if certain medications in your medicine cabinet might be affecting your memory and thinking? Research has found surprising connections between common prescriptions and cognitive changes, especially in adults over 60. Today, Dr. Wilson will reveal 9 medications that may impact brain function, and most importantly, what you can do about them if you're taking them. Don't worry, she'll never suggest stopping any medication without proper medical guidance, but understanding these effects could be life-changing. Before we dive in, we'd love to know where you're watching from. Drop your city in the comments, and don't forget to like and subscribe for more evidence-based health information for seniors. Now, let's start by understanding why your brain might be more sensitive to medications than you realize. "I just keep forgetting things," says 72-year-old Emily from Portland. "My doctor tells me it's just age, but I'm not convinced. Some days I'm sharp as a tack, and others I can't remember what I had for breakfast." Emily's concern is valid. While some memory changes are part of aging, what many seniors don't realize is that their medicine cabinet might be contributing to the problem. As we age, our bodies process medications differently. Our liver and kidneys work more slowly, causing drugs to stay in our system longer. The protective blood-brain barrier becomes more permeable, allowing more medication to reach our brain. And with age, our brains produce less acetylcholine, the chemical messenger responsible for memory and clear thinking. This is where many medications can create a perfect storm, explains Dr. Wilson. Certain drugs, especially those with anticholinergic properties, block acetylcholine, the very chemical your brain already has less of as you age. Think of your brain cells having conversations using acetylcholine as the telephone line. Some medications essentially cut these lines, making communication harder. One drug might cause minor memory glitches, but multiple medications together can disconnect entire networks. What's concerning is that nearly 65% of Americans over 65 take at least 3 prescriptions daily. When these drugs interact, their effects on memory can multiply. "I'm not saying stop your medications," Dr. Wilson emphasizes. "I'm saying knowledge is power. Understanding these effects can lead to better conversations with your doctor." 2 ANTIHISTAMINES. Remember that drowsy feeling after taking Benadryl? That foggy sensation isn't just affecting your alertness. It might be temporarily affecting your memory, too. Many patients don't realize that over-the-counter allergy medications and sleep aids containing diphenhydramine, found in Benadryl and most PM products, are among the strongest brain foggers out there, says Dr. Wilson. These first-generation antihistamines belong to a class called anticholinergics, which block those crucial memory messengers in your brain. While occasional use isn't concerning, regular or nightly use raises red flags. Barbara, a 68-year-old Florida retiree, came to Dr. Wilson confused about her increasing forgetfulness. "I've been using PM sleep aids every night for years," she admitted. "No one ever told me they could affect my memory." A study in JAMA Internal Medicine found that people taking strong anticholinergics daily for just 3 years had a significantly higher risk of developing dementia. What starts as mild confusion can potentially contribute to more serious cognitive issues over time. The good news? Safer alternatives exist. For allergies, newer antihistamines like loratadine, Claritin, or keterizine, Zyrtec, don't cross into the brain as easily. For sleep, talk to your doctor about melatonin or practicing better sleep hygiene. If you've been taking diphenhydramine regularly, don't panic, and definitely don't stop abruptly. Instead, Dr. Wilson suggests, start a conversation with your doctor. Simply say, "I've learned that my allergy medication might affect memory. Could we discuss alternatives?" 3. Benzodiazepines. I started taking Xanax for anxiety, but now I worry more because I can't remember things, confides Robert, a 70-year-old retired teacher from Chicago. Some days, I feel like I'm walking around in a fog. Robert's experience with benzodiazepines, medications like alprazolam, Xanax, diazepam, Valium, and lorazepam, Ativan, is increasingly common among seniors. These medications are prescribed for anxiety, insomnia, and muscle spasms. Benzos work by enhancing a brain chemical called GABA, which essentially slows down brain activity, explains Dr. Wilson. That's why they're effective for anxiety. They put the brakes on a racing mind. But your brain doesn't appreciate being slowed down for extended periods. Long-term use can affect how your brain processes and stores new information, making it harder to form memories. A study in the British Medical Journal found that people taking benzodiazepines for more than 3 months had a substantially higher risk of developing Alzheimer's disease. Higher doses and longer use increased the risk further. I see the effects in my patients, notes Dr. Wilson. First, they're a bit more forgetful. Then, they start having trouble focusing on conversations. Many assume it's just getting older, but often it improves when we address the medication. If you're taking benzodiazepines, here's Dr. Wilson's most important advice. Never stop these medications suddenly. That can cause serious withdrawal effects. Instead, work with your doctor on a gradual reduction plan if appropriate. Effective alternatives include cognitive behavioral therapy, mindfulness practices, and different medications with less impact on cognition. Even simple breathing exercises can help manage anxiety. Proton pump inhibitors. I take my little purple pill every morning without fail, says Martha, a 75-year-old from Boston. For years, it's kept my heartburn away. But lately, I've been having these strange moments where I can't find the right words. My doctor didn't connect the dots until I mentioned both issues in the same visit. Martha's purple pill belongs to a class of medications called proton pump inhibitors, or PPIs, including omeprazole, Prilosec, pantoprazole, Protonix, and esomeprazole, Nexium. These medications are remarkably effective at reducing stomach acid and treating conditions like heartburn, acid reflux, and ulcers. But here's what many seniors don't realize. By reducing stomach acid, these medications can interfere with your body's ability to absorb certain nutrients essential for brain health, particularly vitamin B12 and magnesium. Vitamin B12 is crucial for maintaining healthy nerves and brain cells, explains Dr. Wilson. When levels drop too low, people often experience confusion, memory problems, and even symptoms that can mimic dementia. A large German study involving over 73,000 seniors found that regular users of PPIs had a 44% increased risk of developing dementia compared to those who didn't take these medications. The researchers suggested that nutrient deficiencies might be part of the explanation. Watch for warning signs like unexplained fatigue, tingling in hands and feet, difficulty with balance, or increasing forgetfulness, all potential indicators of B12 deficiency. This doesn't mean you should stop your medication, Dr. Wilson clarifies. For many people, especially those with severe reflux or Barrett's esophagus, these medications prevent serious complications. Instead, consider these smarter approaches. Use the lowest effective dose. Discuss with your doctor whether you can take drug holidays or use the medication only when symptoms flare up. Ask about H2 blockers like famotidine, Pepcid, which may have less impact on nutrient absorption. And if you do need long-term PPI therapy, ask your doctor about monitoring your B12 and magnesium levels. 5. Anticholinergics for bladder. I chose to stop worrying about finding the nearest bathroom and started wearing protection instead, admits Eleanor, a 78-year-old from Seattle. After 3 months on bladder medication, I couldn't remember my grandchildren's birthdays. The trade-off just wasn't worth it for me. Medications for overactive bladder, including oxybutynin, ditropin, tolterodine, Detrol, and sulfonacin, Vesicare, work by blocking acetylcholine, the same crucial brain chemical we've discussed that's involved in memory and thinking. What makes these medications particularly concerning, Dr. Wilson explains, is that they have some of the strongest anticholinergic effects of any drugs we prescribe. And because bladder issues are so common in seniors, these medications are frequently prescribed without much discussion of cognitive risks. The evidence is compelling. A groundbreaking study from the University of California, San Francisco found that older adults taking these medications had physically smaller brains on MRI scans and performed worse on memory tests compared to those not taking them. We actually saw brain shrinkage in areas responsible for memory and thinking, noted the researchers. Even more concerning, these changes were detectable after just a few months of regular use. Common warning signs include having trouble finding words, feeling mentally foggy, or noticing that you're more forgetful since starting the medication. Some patients report feeling confused about time or having difficulty following the plot of a TV show. If you're taking bladder control medications and concerned about cognitive effects, Dr. Wilson recommends exploring alternatives. Pelvic floor physical therapy, bladder training techniques, and lifestyle modifications like timing fluid intake can be remarkably effective, she notes. And for those who still need medication, newer options with lower anticholinergic effects may provide relief with less cognitive impact. The key is having an honest conversation with your doctor about what matters most to you, weighing quality of life against potential cognitive effects. For Eleanor, the memory of her grandchildren's special days was too precious to risk. 6. Sleep medications. I didn't realize I was forgetting entire conversations until my son recorded our phone call and played it back the next day, shares James, a 69-year-old retired accountant from Texas. I had zero recollection of telling him about my doctor's appointment or asking about his kids, and I'd been taking Ambien every night for years. Sleep medications known as Z drugs, including zolpidem, Ambien, ezopiclone, Lunesta, and Zaleplon, Sonata, are among the most commonly prescribed medications for older adults struggling with insomnia. While they can help you fall asleep, their effects on memory can be significant. These medications work by depressing brain activity, explains Dr. Wilson. The problem is, they don't just affect the parts of your brain controlling wakefulness, they also impact regions responsible for making and storing memories. When you sleep naturally, your brain cycles through different stages, including deep sleep and REM sleep, which are essential for consolidating memories and clearing away toxins. Z drugs can disrupt these normal cycles, leading to what appears to be a full night's sleep, but without all the cognitive benefits. A study in the British Medical Journal found that seniors taking Z drugs had significantly higher rates of memory problems, confusion, and falls. Even more concerning, some patients experience complex sleep behaviors, activities like driving or eating while not fully conscious and with no memory of the event the next day. For short-term use during periods of significant sleep disruption, these medications can be appropriate, Dr. Wilson acknowledges. The concern is when short-term use stretches into months or years. If you're currently taking sleep medications regularly, look for signs like morning grogginess that lasts well into the day, gaps in memory, or finding evidence that you did things during the night that you don't remember. Rather than stopping suddenly, which can cause rebound insomnia, work with your doctor on a gradual tapering schedule while adding in natural sleep strategies, consistent sleep-wake times, avoiding screens before bed, keeping your bedroom cool and dark, and practicing relaxation techniques. For many of Dr. Wilson's patients, cognitive behavioral therapy for insomnia, CBTI, has been life-changing, addressing the root causes of sleep problems rather than just sedating the brain. 7. Statins. I thought I was developing early dementia, Thomas, a 67-year-old from Denver, confides. I'd walk into rooms and forget why, lose my train of thought mid-sentence, and struggled with simple math. When my doctor suggested it might be my cholesterol medication, I was skeptical until we switched to a different statin, and the fog began to lift. Statins like atorvastatin, Lipitor, simvastatin, Zocor, and rosuvastatin, Crestor, are among the most widely prescribed medications for lowering cholesterol and reducing heart disease risk. While these medications save countless lives, some people experience cognitive effects that often go unrecognized. What many doctors and patients don't realize, explains Dr. Wilson, is that cholesterol isn't just something to minimize in your bloodstream. It's actually essential for brain health. About 25% of your body's total cholesterol is found in your brain, where it helps form the protective sheaths around nerve cells and supports the production of key brain chemicals. While most people tolerate statins without cognitive issues, some experience what's been termed statin brain fog. Symptoms like forgetfulness, confusion, and difficulty concentrating. A study in the journal Pharmacotherapy found that when patients experiencing memory problems stopped taking statins, 75% saw improvement in cognitive function. The connection appears stronger with fat-soluble statins like simvastatin that can more easily cross into the brain, Dr. Wilson notes. Water-soluble options like pravastatin or rosuvastatin might be better tolerated by sensitive individuals. If you're taking a statin and experiencing new cognitive symptoms, Dr. Wilson suggests this approach. Keep a simple log of when you notice memory issues, then share this information with your doctor. Never stop a statin abruptly, as this can increase heart attack risk. Some patients find that adding CoQ10 supplements helps reduce cognitive side effects, as statins can deplete this compound that supports brain energy production. Others benefit from switching to a different statin or adjusting the dosage. The key is balancing cardiac benefits against quality of life, emphasizes Dr. Wilson. For high-risk patients, the heart protection absolutely outweighs potential cognitive effects. But for lower-risk individuals, there's room to fine-tune the approach. 8. ANTIDEPRESSANTS My doctor prescribed amitriptyline for my chronic pain, recalls Patricia, a 71-year-old from Michigan. It helped the pain, but I started forgetting appointments and getting lost while driving in my own neighborhood. When we switched to a different type of antidepressant, my memory problems improved dramatically. Older antidepressants called TRICYCLICs, including amitriptyline, doxepin, and nortriptyline, are sometimes prescribed for depression, nerve pain, migraine prevention, and even insomnia in older adults. While effective for these conditions, they carry significant anticholinergic properties, meaning they block acetylcholine, that essential brain chemical involved in memory and thinking. What's concerning about tricyclics is their potent anticholinergic effect, explains Dr. Wilson. Many seniors are prescribed these medications for non-depression uses like pain or sleep, often at lower doses, without realizing the potential cognitive impact. A landmark study in JAMA Internal Medicine found a dose-dependent relationship between anticholinergic medications like TRICYCLICs and dementia risk. This means higher doses and longer use were associated with greater risk, information that's particularly important for older adults who might be more vulnerable to these effects. The cognitive effects can be subtle at first: mild forgetfulness, trouble concentrating, or feeling mentally sluggish. But over time, these symptoms can worsen and significantly impact quality of life. The good news is we have many newer antidepressants with minimal anticholinergic effects, Dr. Wilson notes. Medications like SSRIs and SNRIs can effectively treat depression with much less impact on cognition. If you're taking a tricyclic antidepressant, Dr. Wilson emphasizes, never stop these medications abruptly. Sudden discontinuation can cause serious withdrawal effects. Instead, talk with your doctor about whether a gradual transition to a more brain-friendly alternative might be appropriate. Depression itself can cause cognitive problems, so proper treatment remains crucial. The goal isn't to stop treatment, but rather to find the approach that best preserves both emotional and cognitive health. For Patricia, switching to a different class of medication meant effective pain control without the memory issues. Truly the best of both worlds. 9 ANTIPSYCHOTICS. Dad became so agitated in the memory care facility that they started him on an antipsychotic, shares Richard, whose 85-year-old father lives in Arizona. His aggressive behaviors improved, but he stopped recognizing family members and became almost zombie-like. We worked with a geriatric psychiatrist to find alternatives, and while he still has dementia, he's much more present now. Antipsychotic medications including risperidone, Risperdal, quetiapine, Seroquel, and olanzapine, Zyprexa, are sometimes prescribed to manage challenging behaviors in seniors with dementia, despite not being FDA approved for this use. In fact, these medications carry the FDA's strongest warning, a black box alert, about increased risk of death when used in elderly patients with dementia. These medications were developed for conditions like schizophrenia, not for the behavioral symptoms of dementia, explains Dr. Wilson. They work by blocking dopamine and serotonin receptors in the brain, which can help reduce hallucinations or aggression, but often at the cost of further reducing cognitive function. While briefly calming agitation, these medications can cause increased confusion, excessive sedation, and faster cognitive decline. Studies show they may accelerate the progression of dementia rather than simply managing its symptoms. What's troubling is that many families aren't fully informed about these risks, Dr. Wilson notes. They see the immediate benefit of reduced agitation, but don't realize the cognitive trade-off that's occurring. For seniors without dementia who take these medications for other conditions, the cognitive effects can include memory problems, difficulty thinking clearly, and a sense of mental dulling or emotional flatness. Before considering antipsychotics, especially for dementia-related behaviors, families should explore non-drug approaches, advises Dr. Wilson. Often, behaviors have triggers: pain, overstimulation, confusion, or unmet needs. Addressing these root causes can reduce the need for medication. When medication is truly necessary, using the lowest possible dose for the shortest time period is crucial. Regular reassessment to determine if the medication is still needed should be standard practice. Richard's experience with his father highlights an important truth. Sometimes the behaviors we're trying to manage with medication are actually expressions of the person's remaining selfhood. Finding the right balance between comfort and cognition requires thoughtful, individualized care, protecting your brain. After learning about medication effects on memory, I felt pretty worried, admits Carol, a 68-year-old from Minnesota. But my doctor helped me create a brain protection plan alongside my necessary medications. Now I'm not just taking pills, I'm actively supporting my brain health every day. While managing medications wisely is important, Dr. Wilson emphasizes that protecting your brain is about what you add to your life, not just what you might need to reduce. Research has identified powerful natural approaches that can enhance cognitive resilience, particularly through nutrition. Think of these brain-healthy foods as deposits in your cognitive bank account, suggests Dr. Wilson. They build reserves that can help offset other challenges to brain health. Blueberries top the list of brain-protective foods. These tiny fruits pack an impressive punch of antioxidants called anthocyanins that combat oxidative stress and inflammation, two key drivers of brain aging. A study from the University of Cincinnati found that older adults who consumed blueberry juice daily for 12 weeks demonstrated significant improvements in memory and cognitive function. I tell my patients to think of blueberries as nature's little brain pills. Dr. Wilson smiles. A handful a day, fresh or frozen, is an easy addition to your breakfast or smoothie. Fatty fish like salmon, mackerel, and sardines provide essential omega-3 fatty acids, particularly DHA, which makes up a significant portion of your brain's structure. Research in the Journal of Alzheimer's Disease found that people who ate fish at least once weekly had a 60% lower risk of developing Alzheimer's compared to those who rarely consumed it. The third brain-protecting powerhouse is leafy greens, spinach, kale, and collard greens. Rich in nutrients like vitamin K, lutein, folate, and beta-carotene, these vegetables have been shown to slow cognitive decline. One study found that people who ate 1 to 2 servings of leafy greens daily had the cognitive abilities of someone 11 years younger. Beyond nutrition, research consistently shows that regular physical activity, quality sleep, stress management, and mentally stimulating activities all contribute to cognitive resilience. The most powerful approach combines brain-healthy habits with careful medication management, Dr. Wilson emphasizes. Work with your healthcare team to regularly review all your medications, and don't be afraid to ask about cognitive side effects. Remember, your brain health matters just as much as treating any other condition. Understanding medication effects on memory empowers you to protect your brain without stopping necessary treatments. Always consult your doctor before making changes. Your complete health includes both body and mind. Have you experienced medication-related memory changes? Share below. Your story might help others. Thank you for watching. Like and subscribe for more senior health insights.